Welcome to Thrive on Plants, the podcast where we explore the science, the stories, and the strategies behind living on a plant-powered path. I'm your host, Dr. Daphne Bascom. If you're joining us for the first time today, welcome. And if you're returning for another episode, I want to thank you because we appreciate the time that you spend with us every week. Today, I'm honored to bring you a deeply inspiring conversation with Laura Valero. Laura is a nurse practitioner, a Gulf War veteran, and a board-certified lifestyle medicine professional. Laura's story is anything but ordinary. From military intelligence and federal pandemic planning to living with invisible illness and becoming a fierce advocate for plant-based living, she embodies what it means to reinvent yourself with purpose. We'll talk about everything from fibromyalgia and ADHD to rural health equity and the stigma of women's pain, and how Laura channels those lived experiences into compassionate, deeply informed patient care. Whether you're a veteran, a healthcare provider, or whether you're navigating your own health journey, this episode will move you, inform you, and empower you to take that next step. Laura, welcome to Thrive on Plants. I'm so excited that you're here with us today.
Thank you, Daphne. I am just as excited to be here with you as well. Thank you for the invitation.
No, I have enjoyed getting to know you, to learning more about your story, and I appreciate the fact that you are going to share it with our community today.
Excellent.
Before we get started, though, I want to do a quick myth-busting quickfire round. And these are just some questions that I came up with randomly that I'm hoping we're going to touch on all of them. And your story is so rich that there are so many things that we could cover today. But I'd love to hear you reply yes or no to 5 quick questions.
Okay.
First question, is fibromyalgia all in your head?
No.
Can a whole food plant-based diet truly reduce autoimmune symptoms?
Yes.
Do attention deficit hyperactivity disorder and chronic pain often go undiagnosed in women?
Yes.
Does menopause automatically make chronic pain worse?
That's a good one. Maybe.
And last one, can rural clinics deliver high quality lifestyle medicine despite resource limits?
Yes.
Wonderful. Laura, we have a lot to unpack today, but first, I know you're a vegan superhero, and I know that many people in our internal community may be familiar with you, but I don't think they know your whole story because I know I didn't. But I would love to hear a little bit more about your amazing career path from Air Force intelligence to the pandemic to working where you are now in a rural health clinic. How did all of these roles come to be? How do they interdigitate with your plant-based journey? And how have they contributed to your resilience and the adaptability that you bring into your clinical practice today?
Excellent. Lot to unpack there. We could spend about 3 hours. So I'll give you the abridged version. So I'm from Boise, Idaho. Went to a very small school and wanted to get away from there. So I ended up going to study pre-med at Washington University in St. Louis, which was a big culture shock for me in many ways. And um, actually ended up not having a lot of confidence, which is a big difference from then to now. So I didn't feel confident to take the MCATs. I didn't feel that I really had it in me to go to medical school. I probably did, but I didn't believe in myself. So I ended up getting a full ride Air Force scholarship. And so it ended up going into that path. And when you do that, you don't really have a choice what career field. You have your dream sheet. And so I ended up in the intelligence career field, which was not where I asked. I wanted to go into public affairs, but they're very similar because you do give briefings, you do research, you dig into different areas. So and then once you get into the Air Force, again, you don't have a choice where you go. And I think I asked for Germany, and I ended up in Korea. So go figure, go figure. So but with that, when you end up in those different areas, you have to learn a new job. In Korea, I was more at the strategic headquarters level. After that, they sent me to a squadron. So now I had to take what I knew at that level and take that basic knowledge that about air defense systems and air forces and whatnot, and then bring it down to a different level and be able to thrive and excel at that level. And so so from there, we came to DC. In the middle of all of that, we ended up deploying. We had just finished a big exercise, and that was when Saddam invaded Kuwait. So, boom! At the drop of a hat, you find yourself on a 2-day journey to someplace you've never been before, and then have to figure it all out. How are you going to? Where's the food going to come from? Obviously, our kitchen people, they took care of all of that, and we had the lodging, which was tents, things like that. But how do you operate now in this more of an austere environment? So you just have to just really just do it, is really what it boiled down to. So then I went from there to the Defense Intelligence Agency, and with that, really bloomed and was given opportunities, and you take those opportunities and you jump at them and see where you can go. And so I had some really great opportunities. But then it came time to move again, and at that point I had a child. It would have meant my husband uh, restarting his career all over again in construction. So we decided that I would get out, and I ended up with the Federal Aviation Administration. And again, you take what you have, and you go with it, and learn things from a different perspective. And so you just take all of that basic knowledge and you just kind of reshape it and into that new knowledge. So at some point, we became TSA. When I came back from TSA back to the FAA, I actually had to leave the intelligence career field for the first time. I'd been an intelligence officer and an analyst for 18 years, and that was a big jump. So it's a leap of faith. But again, many of the skills and the knowledge, it's all there. You just apply it in a different way. So I went into emergency preparedness and disaster management, where we did continuity of operations. And that was when we were starting the pandemic planning, and my office was asked to write the FAA's pandemic plan. And I was the only person in the office who had a biology background because I was pre-med. Everybody else was poli-sci, history, and they're like, Laura, just take this, please, please, please. And so I did. I was like, wow, this is a really big thing. This is a really big project. And then you realize that there's a lot more strategic implications. It's not just a business continuity plan, but what do you do if an aircraft is inbound and it has a whole bunch of sick people on board? How do you do that? And it's not just your agency, but now you have to deal with Customs and Border Protection because they're there in the airports. You have to deal with the local airport authority. You have to have the CDC. So we did. Again, you just take those opportunities. You just run with them. And so I had a lot of fun doing that at both the national and the international level. And sometimes it's actually kind of my ADHD that kind of leads me into those things, which is something I'm learning now that I didn't understand then. that I would take on these big projects, not really understanding the full realm of implications of how big they were. And then you just do it. You just have to get in and do it. So so did a lot of that, but at that same time, I was also caring for my mother, who was uh, gradually getting sicker and sicker. She had COPD and then lung cancer. Working full time, helping my husband run his company, commuting that awful commute, 1 hour each way, and then also I had 3 children. And in fact, my youngest was a newborn when I started all this pandemic planning because I had her at the age of 40. And so it at some point it is just too much. And you start really getting burned out. So the FAA offered early retirement literally a month after my mom passed. And and working in the pandemic environment, working alongside the CDC, learning more about public health really whet my appetite to get back to what I had originally started out to do back in the 80s, which was to get into healthcare. And so that just afforded me that opportunity then to retire at the top of my game there and delve into something completely brand new. And again, having to navigate new realities like online classes. We didn't have online classes. Shoot, I had a manual typewriter the first time around in college. So how do you do these discussion board posts? What is this? And so learning that, and then learning a new vocabulary as a nursing student, and then again, and then starting off as a nurse, where you're at the bottom of your game. There, you're just a novice, you're barely learning, and then gradually working your way up, being curious and asking all the questions. And I always knew that I wanted to be a nurse practitioner because I wanted to practice the art of medicine. So I, managing that. So, but through all of that, it's just a matter. It was just in all of those, you just had to learn to be flexible. And my motto has always been Semper Gumby, always flexible. And if something comes up, then you just address it. There were plenty of times when I had to be deployed, or we had a pandemic happen, and that was the first one, the 2009. We worked a lot of hours, and you just lean into your circle to support, and you just push in. So that's where a lot of my resilience came from, was um, knowing that I had to have those tools in place and then using them.
But that's quite a bit of journey. I mean, you've been fortunate to have multiple careers in your lifetime.
I am blessed. I am blessed in that regard. I am truly blessed, and the winks, those opportunities, those coincidences, those glimmers have always been there, and so I am truly blessed in that regard. Truly.
And Laura, when along this path I'm assuming that you didn't learn about plant-based nutrition when you were studying to become an NP. So how did you go from omnivore? How and why did you go from omnivore to becoming fully plant-based?
Sure. So even in nursing school, that was not part of our curriculum, although we did have to take a nutrition class as part of the prerequisites. So it really kind of was, again, one of those little glimmers. I was looking for a vegetarian cookbook for my middle daughter, who was at the time was vegetarian, and I'm like, I don't know how to cook. I don't know how to cook without meat. So I was looking on our BFF, Mrs. Amazon, and up came the China study, and I was like, oh, that's kind of interesting. And I was reading the intro to it. I'm like, huh. Well, I had cancer, 6 months ago. I had a melanoma, and I wanted to prevent more melanoma. So I got the book, and there's so much evidence in there. And that's what we were learning in nursing school was, how to evaluate scientific studies and evidence. And it's all about evidence based. And so the evidence was solid. So I decided to go plant based probably before I was even halfway through the book. And what a blessing that has been. What a blessing.
And is is your entire family plant-based or
No, it's just me. Although
okay?
my husband does make some pretty incredible plant-based recipes for us. So he's a master of soy curls. So, but
And that's a good skill to have.
it is.
Laura, one thing, so I've been fortunate to spend a lot of time in the VA healthcare system, um, mainly as a consultant over many years, but I'd love your perspective on your own health journey. You mentioned you had a melanoma. I know that you've had other health challenges. I don't know if you also suffered from any of the challenges that we know some of the veterans from the Gulf War also experienced. But as you've gone through your career journey and your health journey and your journey of understanding how nutrition intersects everything, how has this informed one, the management of your own health, and how has it changed your perception on how we prevent and manage disease with a lens of nutrition?
Oh, some very good questions. So of course I was in the Gulf War, and we had there's something called Gulf War syndrome that has affected many of my fellow veterans, including myself. But we also had the burn pits where everything on our base was thrown into these big pits and lit on fire and with fuel, gasoline. And so now many of us, however many years down the road, 30, 40 years down the road, we're starting to develop a number of chronic illnesses. And some of them are easily diagnosed, and some of them not so easily diagnosed. And I didn't even really realize until I went plant-based and I started exploring more of this, how much some of the things that I had been experiencing were actually related to the burn pits. So for instance, I ended up developing fibromyalgia, which we know is a presumptive condition for being exposed in the Gulf War. I'm currently working with the VA to see if I can be rated for psoriatic arthritis. When I went plant-based, I didn't realize that the pain that I was having in my hands was psoriatic arthritis. It actually took 10 years to get a full diagnosis on that. And that was only just a couple of months ago, to be completely honest. So so now we're understanding how these types of chemicals are affecting many of our veterans. And so they're having a lot of sinus issues because of that, rhinitis, and migraines, and you name it. There's an irritable bowel syndrome. There's a wide variety of different conditions that are now coming up, and even cancers. I have some of my fellow airmen have cancer that at a young age, that their families don't have this type of cancer that's been related to that. So we're starting to see that pop up a lot in our VA clinics, and I do see veterans as a examiner for the VA, where I do their compensation and pension exams or disability exams as they're getting rated or re-rated, so they can get compensation from the VA. And so this is really this journey it's been a long journey, and a very sidewinding journey, has really helped me be able to understand them better, and and when I do my exams, I do listen to them, and they tell me that many of the other examiners are just very like, just ask da 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 da, but don't really dig in and ask a lot of questions, do a lot of measurements, and so I've been told that I'm probably one of the more thorough examiners that they've had for these. But I also talk with them about what they experience. And because we're all taught to suck it up, buttercup, you don't go to medical for your conditions, because if you do, then maybe you might not get that next promotion,
Mhm.
and or that next juicy assignment. So a lot of veterans we're just taught to really keep it hidden, and there's also a lot of trauma that's going on with, especially with my veterans that were from the Army and the Marine Corps, who were much more in the front lines, and and again, they're not, it's now being talked about more, but it just flavors everything. So that has really helped me try to help them, and coach them, and help them understand the VA system as well. Because as a disabled vet, I understand the system, both as a vet, but also from the inside.
Mm. Yeah. And the hard part, so the suck it up buttercup is hard.
Yeah.
And in some ways, I feel like it's something that we as women are told, we maybe we're not told, but we do it anyways because we have no recourse. We have to just keep moving because life is not going to slow down for us. But if you wouldn't mind explaining just so people understand what fibromyalgia is and what psoriatic arthritis is, because to look at you, you're just a vision of health. No one would know that you're living with conditions that have probably caused you chronic pain, and that your life experience was flavored by these conditions, but many of them probably were not necessarily diagnosed at early stages of their development.
Absolutely. So, and again, because when you're so busy taking care of everybody else, and doing all the things, you just put yourself on the back burner.
Mhm.
And I think we women tend to do that because we have so many different roles that we have to play. So fibromyalgia um, is a very complex condition, and oftentimes it takes a long time to get diagnosed because there are no diagnostic tests. There's no lab tests. It doesn't show up on imaging. It's kind of, you rule everything else out before you come up with the diagnosis. And so it's an issue where the problem is actually in the brain, and this is what we call nociceptive pain, and it's the hypersensitivity of things that are going on in the brain, but it manifests itself in the peripheral. So you may have a lot of pain. There's a number of different tender spots along the body that may be affected. You may have a lot of brain fog, feel very fatigued throughout the day, kind of like feel like you're kind of walking through pudding sometimes. And again, it's a bit challenging to get diagnosed, because you have to go through so much, all this, the blood tests and whatnot, in order to get to that. And there's also not a lot of providers out there who are comfortable with diagnosing it. And that's one thing that I hope to be able to improve upon as well, working with my colleague, Dr. Michael Lenz. That's a podcast that I was on his podcast, Conquering Your Fibromyalgia, where I've learned a lot about how, because it's a central nervous system, there's a lot of other issues that are co-related. So you can have migraines, you can have Raynaud's, that's irritable bowel syndrome, and they're all kind of interrelated. Psoriatic arthritis is also, as my rheumatologist said, it's kind of like the garbage dump of rheumatology, where there's not, the labs don't always come up positive. So if you have rheumatoid, we thought I had rheumatoid arthritis for many years, seronegative, because my labs were always negative. But I had the symptoms. I had the joint pain, and um, and it was only recently that we were able to identify that no, it wasn't, and it was that it wasn't rheumatoid, that it was psoriatic arthritis, um, because of some imaging, and the imaging shows that it was affecting asymmetrical joints. I learned so much from my rheumatologist about this, about how it affects joints differently from rheumatoid arthritis. So that's going to help me help my patients as well. Oftentimes, so rheumatoid arthritis, psoriatic arthritis are autoimmune conditions. And for whatever reason, we don't understand why. I personally think it's because of the burn pits, that triggered this inflammation in my body that caused my antibodies to start attacking my joints. And it just eats away at your bones, and can cause a lot of, again, that's similar, that chronic pain, the fatigue, et cetera. There's a lot of overlap, and a lot of people that have autoimmune conditions also have fibromyalgia. And so in this case, and I to kind of go back a little bit, back to when I became plant-based 10 years ago, I was having a lot of symptoms, but I went plant-based and my symptoms disappeared,
That's
which was
really
wonderful, until I started getting into more stress with going into nursing school, and not nursing school, but nurse practitioner school. And then the pain starts coming back. And so I've managed. So I think if I had not been plant-based, I
Mhm.
probably would have been diagnosed a lot sooner. My case is a little bit unique, because most people who develop psoriatic arthritis have psoriasis.
Right.
And we've seen the ads on TV about the plague of psoriasis, and seen the videos of the people that have the big
The
plaques
plaques.
on their
Yeah.
elbows and their knees. I don't have anything like that. I don't have anything like that. So a small percentage, maybe 15% of people just have the arthritis, and not the actual skin issue. So who knows?
So
So
you're a zebra.
that's it. That's it.
When none of us want to be in medicine is a zebra sometime.
Exactly. Exactly.
And Laura, you also mentioned so the the time course of your your exposures with the burn pits, development of probably triggered autoimmune disease, the fibromyalgia, the psoriatic arthritis. Um, how has that changed your approach? Because I'll be honest, you're right. I remember when I was in training and you would see fibromyalgia, you would kind of cringe because you didn't know what to do with it. Um, so you mentioned that you're working with Dr. Lenz, who has kindly agreed to join us on the podcast later this year.
Oh,
But
fantastic.
what can you share with other men and women who, whether it's veterans or um, other members of our community who are navigating chronic pain for whatever reason, about what you've learned in terms of communicating with your healthcare team, the importance of your nutrition? And I know this is a big question, but you also mentioned stress, and we don't often talk about the impact of how stress can trigger flares or exacerbations of some of these symptoms, even if they may have been in remission or quiescent, but periods of unusual stress may all of a sudden result in exacerbations. Um, how has this informed how you deliver care now as a healthcare provider?
So, so going through this, and to be completely honest, until I really started taking the time to care for myself, um, and we as women, we don't do that. We don't care for ourselves. So until I really started digging in and understanding what was going on with me and putting together the puzzle pieces, could I really start addressing it? And a big part of that has only been in the last year. Even though I've had many of these symptoms going back as many as 20, 30 years. And so a big part of it that I recommend to my patients is get a notebook and write down your symptoms and keep track of what types of symptoms you have and when. Try to identify any particular triggers and just and know yourself. But by having it written down and having an idea of what may be going on with yourself, you're going to be better able to help your provider help you. Because when I have somebody that comes in and says, "Well, I'm just tired all the time." So that could go in any number of directions. So do you have sleep apnea? Do you have hypothyroidism? And so being very specific about what your symptoms are and what makes them worse and what makes them better, doing that homework ahead of time will help your provider help you. That's the number one thing. And that's what I tell my patients a lot is to go home and do that. And then let's regather and look a little bit more into that. But having this helps me listen to them more because there were many years. My current provider, we've been with him for quite a long time. He's phenomenal because he does take the time to listen. But the one before him was terrible. I remember him. I was going through an episode of situational depression, and because we put on our face, and he's looking at me, and he says, why do you say you're depressed? You don't look depressed. And I wanted to reach through. I wanted to reach over and just throttle him because I said I'm depressed. I feel depressed. Why don't you ask me some more clarifying questions about what's going on or refer me, whatever, but it's those experiences. So and if you have a provider that is not listening to you, then look around and ask around and find another. But also keep in mind that with today's healthcare system, your provider may only have 5 or 10 minutes with you because, well, that's we could go down a whole rabbit
That's
hole
a
with
whole
that,
nother story.
Daphne. We know that story, but we may not have a lot of time to really do that digging, and we may have to ask you, okay, pick your top three, and anything else, you're going to have to come back and make another appointment, take another day off from work. But
Mhm.
you know, we I don't want to be an hour late for my next patient. So it's about being proactive and being ready, being prepared, and having things written down for your provider.
The journal tip is a great one. Being proactive is key and not necessarily sitting back and accepting that people aren't listening to you. That's huge.
Yeah, yeah. But it's a challenge in this day and age because of the lack of providers, as we're seeing, especially with the post-pandemic, a lot of people are leaving the field, unfortunately. So, yeah. but being your own advocate, doing some, I don't want to call it research because it's not. You and I know what research is, but doing some deep diving and finding resources that can help you as well. There's a lot of good information out there. There's also a lot of bad information.
And it's hard to weed out the good from the bad.
Right, right.
Laura, if you don't mind sharing, were any of your health challenges exacerbated as you went through perimenopause and menopause? Or did you know enough about them at the time to know if the hormonal changes you were navigating was making them better or worse?
So I may be a zebra in this regard as well. I never had a hot flash.
Woohoo!
Oh, I know. But I think a lot of that can be genetics,
Uh-huh.
because my mother didn't have hot flashes. My um, uh, two of my three sisters did not have hot flashes either. So that could be kind of a genetic component. But I had also at the same time I entered into full menopause was when I had also become plant-based.
Hmm.
So that there's I think there that could be a big role in that as well. But as I really got deeper into menopause, and as my estrogen levels got lower and lower and lower, that is when I really started feeling more of my fibromyalgia, and especially the brain fog. That the last couple of years when I'm I things aren't as crazy as they did. I'm now an empty nester, and enjoying my job and thriving with that. And that was when I was really starting to feel it. So a good 10 years into that was so. But definitely, I would definitely say hormones play a strong role with this.
And you had also mentioned with the brain fog, uh, I don't remember if it was earlier or later that you had been diagnosed with or self-diagnosed that you may have attention deficit hyperactivity disorder or ADHD. Um, you mind, this is something that I am hearing from many women, and I don't know if it's more common. I don't know if there's more awareness now. So women perhaps are either keeping the journal, they're more cognizant of the fact that they may be manifesting some things that could be ADHD and they're seeking a full diagnosis. But how did you know that you had ADHD along this beautiful career you've had? And what have you been doing as part of the journey in order to better navigate that? Because I know for some women, that can be a challenge in itself.
Oh, absolutely. Absolutely. So it's really kind of funny. I've always been a very messy person. I can be very organized with my classwork. Like I have all these full like on my um, I on the computer, I have all these file folders where I have each class all lined up, and I had my calendar and everything all lined up with everything. But the rest of my life is just is can be a complete mess. And I've always been one to start new projects. Oh, I want to do stamping, or I want to do scrapbooking, or different things like that. And my poor husband, he kind of rolls his eyes. But um, I actually started suspecting probably, let's see, Marissa is going on, she's 31 now. So with our previous neighbor in our previous house 30 years ago, she told me, she says, Laura, you have ADHD, not the
30.
hyperactive component, not at all. But the distracted variant of it. So she told me, and she's not a doctor or anything like that, but she's like, I think you do. I think you have ADD. And and then she moved, and the person who moved in that same house, she's like, Laura, you have ADD. And I was like, okay, that's very interesting. But I don't really believe it because I'm high functioning. You know, I was reading at the age of 4. I was reading encyclopedias when I was a kid. I was bored. I was skipped grades. I was like a grade and a half ahead of everybody, and graduated high school at 17. All these things. There's no freaking way that I have ADD because I've done all this stuff, and um, and again, you just put it in the back burner, and you just keep doing the things that trying to do the best that you can. And it was really finally working with Dr. Lenz, and reading his material, his book. He has a fantastic book, Conquering Your Fibromyalgia, website and podcast, that I realized that it's all connected. The ADHD, the fibromyalgia, my migraines, my Raynaud's, the chronic pain. It's all up here. And when I learned that, that just is it was mind blowing.
Mind blowing.
So I thought, okay, I've got the time now to work on me. Let's go ahead and start exploring this and dig into this. So I worked with a psychiatric nurse practitioner,
Mhm.
and we went through my whole childhood and everything, all the things I was telling you about, this, that starting the projects. I didn't know that starting all these projects was, and not being able to finish anything is part of it. Um, and so that was earlier this year, and so I started medication, and I have to be very careful with it because of my Raynaud's. So we have me on a very low dose of Adderall, and I remember the first time I started taking it, and I told Christopher, um, I said, is this what normal feels like? To be focused and to be able to get things done. Is this what normal feels like? I had no idea. 60 years. 60
Just think
years.
about everything you could have done.
Right. And so I'm starting to explore that with some of my patients as well. And I had one come in, and also anxiety, by the way, which I don't have, but it also is part of that milieu. And so I had one patient recently who came in for anxiety, and I'm looking at her age, and we start talking. I just so happened to have a little bit extra time, and she said, yeah, I used to have migraines, and I somebody has told me in the past that maybe I have fibromyalgia,
Mhm.
and and somebody else, and I've always been very inattentive, and somebody else's, another provider had told me that maybe I have ADHD. And so when I shared with her what I knew, I think both of us were practically in tears because nobody had put together all the puzzle pictures. And and I don't know that anybody else, that I know Dr. Lenz is starting to speak in the ADHD conferences and things like that, but he has done a phenomenal job of putting all of that together. And we need to have more providers be able to do that, to connect those dots.
And Laura, have you found or have you experienced, and I don't know, I'd love to talk a little bit more about the work you're doing in your clinic, but whether it's in the plant-based community or women in general, do you feel that sometimes there's a perception that if I have to take a medication, I'm weak, or that taking medication, and I'll say and everyone who knows me knows, I am lifestyle first, 100%. Let's find out what we can do from a lifestyle perspective. But I also want to treat the individual holistically. And sometimes I feel whether it's ADD, whether it's menopause, whether it's fibromyalgia, that there's a perception that if I have to take something, I'm weak, as opposed to I'm taking something to help me be stronger. If that
Oh,
I
I
don't,
am so glad you asked this because, especially for us in the plant-based community, there is this aura of when you go whole food plant-based and you're addressing the sleep and the stress and whatnot, that you shouldn't need anything else. And yet we are human.
Mhm.
We are human. And so there are a number of other people in our circles who have developed issues and have hidden them in the vegan world because they're big personalities and because they didn't want to come across as people will go away from what we teach. They will say, well, look, you did all the right things and you still got lung cancer like Chef AJ. Her cancer went from stage 1 to stage 3 because of that. And she's now open and sharing. And I think the outpouring of support for her for that has just been tremendous. And then we have Chuck from Dr. Bernard's podcast, um, that has been open very, very recently as well about his health struggles, because we have this aura that if you do all the things, you don't need medicine.
Mhm.
But we have to get away from that because sometimes medicine is important. And it's not just the antibiotics because you got a urinary tract infection or pneumonia or whatever. But if sometimes we need medication to again help us thrive and be the best that we can be. And that's okay. I struggled with starting methotrexate for my psoriatic arthritis because it's it's going to depress my immune system. If I want to get a vaccine, I have to go off of it for 2 weeks. And I really struggled with that decision. But I know that even though I'm doing all the right things, this disease is still damaging my bones
Mhm.
to the point where I even had osteoporosis at a very young age, at 55. And uh, before we even screened for osteoporosis, I already had it. And so, so I am taking it because I want to live and thrive a long, healthy life without disability. So sometimes we have to. And guess what? It's okay. It is okay. It is not a sign of weakness. I really think of it as a superpower.
Laura, thank you. And I agree. Um, and we do have to, doing all the things we do doesn't make us bulletproof to other things in life, other diseases manifesting themselves. And I appreciate you sharing your experience and the fact that, yes, you wrestled with some tough decisions because there's most of the medications, whether it's for your arthritis, other things that people may be seeking treatment for, they're not always benign, but we are human. And sometimes we have to leverage traditional medicine to help us thrive and continue to thrive as strong, resilient, plant based humans.
Absolutely. And again, with that foundation of healthy nutrition, um, making sure to prioritize sleep and stress management, physical activity, those things. Those are like the core of what we should be doing. Absolutely.
Laura, I'd love to shift topics a little bit if you don't mind.
Sure.
And when it comes to the core of what we should be doing, one thing that I get a sense that you're passionate about, and I share your passion, is health equity and delivering care um, in communities that may be underserved. Can you share a little bit about the clinic where you're working as a nurse practitioner today, about some of the challenges that you encounter in terms of delivering healthcare in that setting, and what you think we can or should be doing differently to ensure that we're providing equitable care across wide swaths of our communities?
Sure. Thank you for that question. So I am a nurse practitioner in a very small clinic in Culpeper, Virginia, which is a rural community southwest of DC. And this is a farmland area, but we have a lot of greenhouses. We have a lot of farmers, a lot of dairy cattle, dairy farmers out there, the greenhouses. So we have a very large Hispanic community. And but I also have a lot of patients that are on Medicaid, for instance. And so one of the areas is that with the Hispanic community like that, their ability to access the healthcare system is a challenge because they may or may not have health insurance, but most of the time they don't have somebody who can speak their language. Fortunately, I can. That's almost 34 years married to a Spaniard. And so I'm the only readily accessible healthcare provider in our area who is fluent in Spanish. And there are days when I do nothing but speak Spanish all day long and even have to interrupt because we're so small, we don't have a Spanish speaking receptionist.
Uh-huh.
So sometimes my MA will hand me the phone and say, "There's somebody Spanish. Can you help them?" Whether it's understand a medication or make an appointment or whatever that because they don't speak it. So this is a really, really big issue in these areas. And healthcare can be expensive for them, and they have a lot of chronic health diseases. Some of it we know with the Hispanic population in particular, there is a genetic tendency to have diabetes. And compounded with they love their beef and their pork. So there's a lot of cultural issues with that as well. So so and they can't afford the really good medications, the Jardiance, the Januvia, the Ozempics, things like that. We're treating them with the stuff that's the cheapest and trying to do the best we can. So that is a really big challenge in that regard. We are also the only clinic that doesn't have a 1 year wait list to be seen for primary care. And this is
A
with
1 year wait list?
yeah, yeah. UVA has a 1 year wait list for their primary care clinics. So yeah, it's a little bit wild. So um, and the other issue we have is the lack of specialists. We have UVA has like we have a podiatrist, we have orthopedics, we have cardiology, nephrology comes down every once in a while, like once a week. We do have the dialysis clinics, but if you want any specialty care, you're going to have to travel an hour in any direction to Warrenton, to Fredericksburg, to UVA. And many times, like UVA for a specialist, it's a 9-month wait list to be seen there as a specialist. And if you have Medicaid, many of my patients have Medicaid.
Yeah.
So ear, nose, and throat, they're having to travel from Culpeper to Northern Virginia. Same with rheumatology. They're talking 2 hours one way to be seen for specialty care. So this is quite a bit. It's quite a challenge. So we have to do a lot to be able to try to treat this as much as we can within our clinic. And like I said, it's a small clinic. I'm the only nurse practitioner there. Monday, Tuesday, Wednesday. My coworker is the only PA there Thursdays, Fridays. We're trying to hire another one, but nobody wants to come to Culpeper, and UVA is hiring, and so we have to do a lot more in our clinic than you might find in other clinics.
And Culpeper is probably not the only rural town that is suffering these issues.
Exactly, exactly.
Now, I also know that you're a Food for Life instructor. Um,
Yes.
do you get to practice any of that in your clinic or in your community?
So I do more of that in Fredericksburg. So I don't live in Culpeper. I live an hour away in Stafford. So I've been doing more of that. I'm also a Building Healthy Communities leader. And so I give classes through there, through our local co-op. That's one thing I have not really been able to do as much because I'm so busy with it, with everything else. And so at some point, I do want to be able to do more. Still trying to figure out how, with the billing and trying to get people in, how to do shared medical appointments. But it's a challenge because we're talking taking 2 hours out of my day, and what it is to do it in the evenings. Are people going to come consistently? So we're still thinking along those lines, like how to do that.
But that's a huge opportunity. I mean, the wonderful thing is they have you there in the clinic because you're a resource for so many reasons. Not to mention that you're bilingual, awesome nurse practitioner, plant-based food for life instructor. So you bring a whole scope of interests, passions, and knowledge that they may not otherwise get in that community. So
Oh,
thank
thank
you.
you.
Um,
Oh, you're welcome. I love what I do. I love what I do. And I think in my patients that I use like a flipped classroom kind of approach. And so my patients that so I give them the resources, and I draw pictures and give them websites and podcasts and um, my favorite recipes and things like that, and allow them to kind of explore on their own. I would like to be able to do more, really, with things like health coaching with them. But there's only so much time. There's only so much time, and I think that is a uh, just a real travesty with our whole allopathic system, where even to be able to refer them to a registered dietitian, that it's not always covered by insurance, and they don't have the money to do it, and they really need that coach to help them carve out like small steps that they can do every day and every week, to identify what is their motivation, what are their dreams, their goals. Insurance doesn't cover that. And yet, I think if we were able to do that, we could do so much more than just slap a medication on something.
100% agree. We don't look at root cause. Um, I mean, we don't fix the problem. We provide a solution or band-aid.
Right,
And
right,
all
right.
we're doing is putting band-aid after band-aid on someone where if we could take the time, which is why I love coaching, to
Yeah.
actually get to the root of what is going on in life and address some of that, maybe we wouldn't need to be so medication heavy.
Exactly, exactly.
I have a big question to ask you, and I think it ties into this: how do we do better? What gives you hope about lifestyle medicine, about plant-based nutrition, and about healthcare in general? I mean, you went from intelligence to healthcare. Sometimes I feel like those two are they can almost be at conflict. But what can we look forward to from your perspective in terms of how do we do better? Because my biggest worry is that we're not getting healthier as a country. And the competing interests, the misaligned motivations, most of them financial, that you're not necessarily compensated to keep people healthy. Um, but there has to be something that continues to be the spark in you that you wake up every day. And I know patient care excites you, but what in the bigger picture are excites you about the opportunity for us to do better and be better?
Right, right. So a big part of it is educating the next generation. So one of the things I get to do is I get to preset nurse practitioner students.
Okay.
And so I have my one, two, three, my fourth one with me currently, and they get to learn all the things that I learned, and I teach them all the things that I've learned about treating the underlying cause and not just putting that band-aid on, as you had mentioned. So we have to really focus on that next generation. And so I see with the with ACLM, the American College of Lifestyle Medicine, that we are starting to do that, and we are starting to get that populated in the medical schools. I think we probably need to do more in the NP and the PA schools. Because we're seeing more go into those roles as well. Um, and as well as the nursing schools at RN. So I think really focusing on that, and we're going gangbusters with lifestyle medicine in that regard and getting that word out. And so that's what gives me hope, is that we do have it's how I don't know the right word to describe it, but it's like the wave. It's just getting bigger and bigger and bigger. Um, and I've been hearing more from patients or from some of my veterans that they're not my patients, but I do their exams, where they have told me that, oh yeah, my wife's cardiologist said that she should try to eat more plants. And I was like, yes, somebody is listening. So it's getting out there. And that's what really gives me hope. I think the bigger issue is more at the government level. And really, I have these conversations with my patients as well, that it's not their fault. They are going up against the not just pharmaceutical industry, but the food manufacturers.
Yeah.
And once the tobacco companies purchased those food manufacturers and started using their advertising acumen to really get the word out and to start making food more desirable, so that they could make a buck, because that's what our market economy is all about, is the companies have to make a profit in order to be successful on the stock market. And so they do everything they can, even if it's hurting us, because they don't care. So I think there's a lot more to be done at that level, that's way bigger than either of us. And I don't know if that will if that will ever come to fruition. But I tell my patients that this is your opportunity. Like, so those CEOs are making billions of dollars off of you. So
Mhm.
this is your opportunity to give them the middle finger and say, no, I am not going to I am not going to be your victim. And that's really powerful when I do that.
And we need to empower more people to feel that they can give these big organizations the middle finger
Yeah,
by not by voting with their pocketbook. Um,
exactly. Exactly.
so because you and I was looking at the time, I apologize. I know we're way over. Um,
This has been too much fun.
I would, before we wrap up, I would love if you wouldn't mind sharing what does a day in the life of Laura look like? Um, because I know that I have a phrase, I aspire to inspire, and you inspire many people in our community. But I mean, do you work out every day? Do you eat healthy every day? Do you ever eat bad food? What does a day in the life of Laura look like?
We won't talk about tortilla chips. That's
That's
my
okay.
that's my kryptonite. Um, so I'm not perfect. There are days when sometimes when I'm stressed, I want to reach for something that maybe I might not want to, that may not be good for me. So, but I'm also learning to take a pause and create that break between impulse and action, and to ask myself, okay, am I what's that underlying emotion that I'm trying to address, and really roll into that, try some meditation. So for me, I do work out. I try to focus on the days I'm not in the clinic, because my clinic days are 12-hour days. So there's not a lot of time there. I am getting up and walking before I go to work. At least I try to get something in. And So I do a combination. I do walking. We walk our dog twice a day, and I've also been able to do a lot of strength training as well. And we've had to modify, and that's really kind of the cool thing, is that it's not all or nothing. Like, oh, my knee is really bothering me. I can't do anything. But okay, what can I do? And for a long time, for the better part of 6 months, I've not been able to do much of anything, lower body work. But what can I do? And that hurt my knee. So how am I going to modify my upper body workouts so that it doesn't bother my knee? And so yes, I enjoy doing that. And once a month, my husband and I are going to be going on RV trips. We just bought an RV. So next week,
Congratulations.
I'll be on the beach in the Outer Banks, doing more of those types of things. I also help my husband run his company. So my day is not in the clinic. I'm spending time helping him with paperwork. So it's a very busy day. I am trying to learn better to write things down, and to organize my day better, um, because otherwise things aren't going to happen. And I know me now with ADD, that I have to do that.
Mhm.
Otherwise, um, I think something's going to take this long, and it actually takes this long. So if I don't really structure, then things can fall apart. So, but do that. I like to read, and we've been doing a lot of really cool books through our book club, that I've really been enjoying. And cooking. I love to cook, and so um, I love to. I'd like to be able to get more into my cooking classes, but that may come after I retire. So yeah,
After you retire.
that's it's coming a little bit sooner. At least my husband's going to retire. And
Okay.
then we're going to actually, we've got our RV. We're going to hit the road for 2 to 3 months at a time.
Ah, that's going to
And
be wonderful.
so, yeah, and I'd like to be able to meet up with other members of our Building Healthy Communities community, our fellow Food for Life instructors, as we're going around the country. So, yeah.
And we look forward to tracking you on your journey.
I may have to have a blog with
Uh,
that.
why not?
Exactly, exactly.
Before I let you go, I would love to wrap up. I have 6 questions I'd like to ask you, and then I promise I will stop talking. Um, and you can make these short answers or long answers, but
Okay,
they're just, I call them the lightning round, just things
okay.
for food for thought that I want to leave people as we wrap up today's episode to stimulate them to think. But what's one truth about chronic pain that you wish every doctor understood?
That it's real, that even though the patient may not look like they're in pain, trust me, it's there. That our pain scale may look a little bit different, but the pain is real. It's not, we're not making it up.
And what's a health tip that you see online that just makes you cringe?
Oh, there's so many of them. How do you narrow it down? So I had a patient come in recently that I had been to his home country and had been doing colonics
Uh-huh.
and now has diarrhea. And I'm like, oh my goodness, you have such a beautiful treasure of your 37 trillion microbiome. Don't get rid of them. So
Don't.
that's going to be one of them just eat the rainbow and don't do things to mess with your gut microbiome.
I like that one. I've had that issue recently too. If you had a magic wand, what would you change about rural healthcare?
I would make specialty care more accessible to that, whether it's through telehealth. I don't know what the solution is, but we need to get more out there, and also more providers that are bilingual or have the ability to be able to tap into bilingual resources.
Agreed. And speaking of bilingual, what is one piece of advice you would give to Hispanic women who are trying to be plant-based but don't necessarily have access to a lot of resources?
Well, the resources are there. They just don't know how to find them. And my favorite one is Dr. Colin Campbell's website, which he does have a Spanish version of it with webinars in Spanish, recipes and things like that. But I also tell them to tap back to their ancestors. Before the Spaniards came, they were eating predominantly plant-based. So think what your ancestors ate. And those foods are not very expensive. You know, the beans and the lentils and the corn and the squash and whatnot. They're not very expensive and very, very, very super healthy.
Fast forward 10 years, maybe you're retired, maybe you're not. What is your boldest hope for the future of lifestyle medicine?
My boldest hope is that lifestyle medicine is a required component for every medical school, every nurse practitioner school, and every PA school, so that those providers have the tools with which to address the underlying cause of chronic disease.
Beautiful. That's a that's a bold vision, and I know ACLM is working to get there. Last question, Laura. If you weren't a nurse practitioner, what mission or passion project would you take on next?
Grandmother.
Oh,
Uh, I hope we have two of our daughters were married in the last year and a half, and so I'm hoping uh, to be a grandmother one day. But if it happens, it happens. If it doesn't, it doesn't. So, but but also, I mentioned, my husband and I are going to, when we retire, we're going to be doing these travels and in Spain, whether it's across the country, but to be able to continue to populate these uh, what I know and to be able to share. So, you know, again, whether it means being able to give talks with other building healthy community meetups as they have them, or to give talks at veg fests, things like that. Do a blog, have a cooking show, because I love to cook, and so those are some of the things that I've been kind of canoodling, as far as like what does the next version of Laura look like? Because we've already had quite a few different ones.
And the next one's going to, I mean, you continue to evolve and grow stronger and touch more lives. So I know whatever the next version will be, she'll be wonderful too.
Oh, thank you. Thank you.
Laura, this has been a pleasure. I appreciate the generosity of your time. I mean, every single topic we discussed today could be a whole hour podcast on its own,
Pretty
but
much.
thank you so much for joining the Thrive on Plants community.
Thank you for inviting me. This was a treasure. This was beautiful. I loved it.
And I hope to have you back another time.
All right. Thank you.
Take care. Today's conversation was a powerful reminder that healing isn't linear. It's layered, it's courageous, and it's often deeply personal. Laura's journey through war zones, motherhood, chronic illness, and reinvention shows us that no matter where you start, you have the power to transform your health, serve your community, and reclaim your voice. Here's my challenge to you this week. Take one insight from Laura's story. Maybe it's about resilience, advocacy, or simply listening to your body, and apply it in your own life. If this episode resonated with you, please share it. Share it with someone who needs to hear it. Leave a review, tag us on social, and help us spread this message of hope and healing. Until next time, stay curious, stay strong, and keep thriving on plants. Take care. The content provided in this podcast is intended solely for informational and educational purposes. It's not designed to replace professional medical advice, diagnosis, or treatment. While I'm a doctor, I'm not your doctor. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health, medical conditions, or treatments. Our goal is to provide accurate and up-to-date information. The discussions and views shared on this podcast reflect the opinions of the host and guest, and they may not align with your unique health needs. Decisions related to your health and wellness should be made in consultation with your healthcare team because they understand your specific circumstances. Thanks for joining us on this journey to thrive on plants, and I hope you enjoy the future episodes.